history and why I'm here. You know, I, as a young adult, tore my ACL in my right knee twice in 1 year and had it repaired twice. And the result of that years later was arthritis and bone on bone. And, you know, I'd go into the doctor like, my knee really hurts. And they were like, well, yeah, there's nothing you can do about it other than get a knee replacement, which I did a few months ago. 4th of November this year, Dr. Lyman performed a full knee replacement. Hooked me up with orthophysical therapy in Ashley here in this office in Post Falls, and you know, she was helping me through it. I did see a Facebook post on BPI, which Gunnar here's kind of in charge of, as I understand, or at least involved with pretty heavily, and they had advertised having a hyperbaric chamber. So I was just interested in it because of my diving background, and asked Ashley about it, and she introduced me to you, and then you took me back here, and the thing was just rolled in. It wasn't even hooked up yet. And so that was kind of exciting. I'm like, this is kind of new and cool. And so I started doing a little bit of research on the benefits of what this would have on somebody with an injury like mine, and I found a few articles specific to wounds, and one gal actually had a knee replacement. One of the things that they recommend doing or advise doing was having a few chamber treatments prior to the surgery, and then having more afterwards. I didn't have the luxury of being able to do that just because of the timing of the chamber here at BPI. So I came in and did, you know, approximately 10 chamber rides, 10 dives over the past couple weeks, and I was in the very beginning. I was having, you know, a lot of pain in the knee, like most people do with this surgery, and of course went through physical therapy and went through just natural healing. But part of the process obviously was to go do the chamber and try that out to see if that worked. And I do think it benefited me. You know, you're not going to go in there and feel like you're 20 years younger or anything else. You know, there is some anti-aging value, I think, to hyperbaric medicine, but you know, I do think it does improve and accelerate healing, especially in wounds. I did notice once I had a few dives under my belt in this chamber that the wound really healed up and just looked like a nice scar. Right now, you know, I'm optimistic that the knee will look really a lot more normal than some of the ones that I've seen on other patients. So I'm kind of excited about maybe what this has brought to me in that regard.
And I think that's important to know what you said about, you know, this is something that can synergize with other things that you're doing to heal as well, with the PT, obviously a good surgeon. So it's not going to be something that is a magic pill that's instantly going to fix your knee, but if we can use it to synergize, especially with physical therapy or other modalities that are being used, it can be even more effective as well.
You know, previously when I was diving and I knew about the chamber, it seemed like as time went on, I heard more and more about the chamber over in Deaconess being used for burn victims and, you know, diabetic wounds that weren't healing, and some of those, you know, things that are really important to use the chamber for, and those are the kind of things that are approved through the FDA, and those are the things that are covered under insurance in most cases, I think. But I think there's a whole realm of things that these can do for the human body that aren't necessarily documented to the point, or researched to the point that the FDA recognizes them for those things. But I think that's coming maybe eventually, and so I think it's a good thing.
Can you speak a little bit on of what the experience was like while you're in the chamber specifically, just to let people know what it's going to be like inside the chamber, or what you felt while you were in there? Yeah,
for sure. So, you know, for me getting in the first day, this door opens and you can see this opening is not giant, so you have to wrangle yourself in there a little bit. It's not really that difficult. It wasn't that difficult for me with a knee injury. Of course, it might be a little harder, and Gunnar and his staff might need to help you in there, but in most cases it's not hard to get in. I mean, you lay down, you're comfortable, they close the door. It can be slightly claustrophobic. For me, I don't have an issue with that, but this is a large enough chamber where there's a lot of room in there, so that shouldn't really be too much of a problem. You know, once he closes the door, he starts to pressurize it. If you've been on an airplane or if you've been scuba diving, you know, you're going to feel your ears popping. He usually pressurizes it really slow, especially for new people, and you're going to, I don't know how many minutes exactly it takes to pressurize, a few minutes, and then eventually you equalize at the pressure that you're going to remain at for the duration of your dive, and then you have again, you're laying down on your back and you have is it cannula?
Nasal cannula.
Nasal cannula. So you're not in a 100% oxygen environment, you're just breathing oxygen through your nose. So that improves the safety inside the chamber dramatically. Under pressure, you're not at risk of having some kind of fire in there or something. So the risks of this are extremely low for the patient. Once you're pressurized, like I said, it's you feel pretty normal. Your ears are equalized. You can bring a book in there and read it, or you can take a little nap, whatever you want to do. Mm-hmm. There is a display in there that I like to kind of look at because I'm a techie guy. Yeah. You can leave that off if you want. I'm assuming. You know, Gunnar takes care of the controls, and when it's all done, thing shuts down and then it starts to depressurize. You have a similar experience with your ears when it's depressurizing, but they do that pretty slow, and it's not really a problem. You can either hold your nose and do a Valsalva movement, or you can just kind of, it's like you're chewing bubble gum, you can kind of click your ears, and it's pretty comfortable. Interesting that North Idaho Physical Therapy's kind of started this BPI wing, and it is interesting to me. You know, the idea behind it is probably more of a health and welfare preventative kind of thing. Certainly people come in here with injuries and problems that they have as they go through life and as they get older, but this is a place where you can come if you're perfectly healthy, if you want to continue, you know, a healthy regime in your life, or if you want to do some things that'll maybe help prolong your life or improve your health as it is. You know, so don't look at physical therapy and BPI as an injury progression solution. This could be something that you actually use as a healthy person to improve your current situation.
Well, that was a great description. I couldn't have talked about it better myself.